Hello and welcome to the Multicultural Media Online Conference hosted by the Ministry of Health, Multicultural Health Communication Service and Multicultural New South Wales. I am delighted to welcome you back to our very first session for 2023. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and I am your moderator for today and for these sessions. We're so pleased to have with us again Dr. Jan Fizzell, our Senior Medical Advisor, to give us some COVID-19 and public health updates. And today, we're so happy to have as our special guest, Maria Cassaniti. She is the manager for the Transcultural Mental Health Line Center to tell us all about the multilingual health lines that's available for multicultural communities. But before we start, we'd like to begin by acknowledging the traditional owners of the land from which we are all meeting from today. We pay respects to elders past and present and emerging, and also pay respect to any Aboriginal colleagues and community members who are joining in this session. We also like to acknowledge and respect the multicultural leaders and elders who are represented in this session today. And we'd like to ask, as you remember, please keep your microphones on mute, but please do ask your questions on the chat. As we have 30 minutes to ask your questions, we have a very interesting topic today to talk about the Transcultural Mental Health Line now that the school has started, and many interesting and challenging news that's come around, and this helpline is really crucial. But would like to ask first, Dr. Jan, how are you and how's it been? It's February 2023 and we're back.
It's lovely to be back, Jess, and it's a great opportunity for us to spread some health news about what's been going on in the public health world and how people can keep themselves and their loved ones safe.
Thank you for joining us.
And thank you for having me.
We'll start with one question, Dr. Jan. How is the COVID situation in New South Wales?
Look, I think a lot of it people who've been sick with COVID over the past few weeks, and some people would know people who've been in hospital who've had complications afterwards. The good news is that we're on the decline, but even when we're on the decline, we know that new variants are starting to develop overseas. We know that people, even when there isn't a lot of COVID around, can still catch COVID from other people. So I'd still really ask people to stay careful. If you're unwell in any way, do a test and stay home until you're completely well. Even if that test is negative, no one wants a cold or flu, because we may start seeing flu start off again soon. It's also really important to keep doing those little things like getting together outdoors when you can, wearing a mask if you're in an indoor crowded place, and also, of course, staying up to date with our vaccination. We've had some news about that recently.
Yes, Atagi has more information and an update for that.
That's right. So a lot of people in the past, few months, knowing that COVID was coming back, have said, when do we get our next COVID dose? And so the Australian Technical Advisory Group on Immunisation is a group of people who are infectious disease experts, public health experts, and consumers who all get together to talk about what's the evidence of what's going on in the world and what do people need to know and what action do they need to take. So what they're saying at the moment is think about the last time you either had COVID or you had a COVID vaccine. If it's more than 6 months ago, on the 20th of February, it's recommended if you are over 65 that you should definitely get another dose of a COVID vaccine. If you're 18 to 64 and relatively well, you should definitely consider it. So have a chat to your GP if you're uncertain, or talk to your pharmacist, but you should definitely consider it. And I particularly advocate this if you're traveling overseas, because people in different countries have got different COVID rules to Australia, and you don't want to get stuck overseas with COVID. If you are 18 to 64 and you have other health problems, it could be diabetes, it could be immunosuppression, then it's definitely recommended that you should definitely get that COVID vaccine booster if it's been 6 months since you had COVID or 6 months since you last had a dose of the COVID vaccine. If you're 5 to 17, so you've got school-aged kids, generally, if they're fit and well at this time, either their COVID immunisation or the fact that they've probably been exposed at school, childcare, or out in the community means that at this time, we're not recommending they have additional doses. But if you've got a child with special needs, they might have had cancer treatment, they may be immunosuppressed, they may have really severe asthma that gets them in and out of hospital a lot, then ATAGI has recommended that they have an additional dose. But again, please make sure you talk to your GP or paediatrician. And if they're under 5, because we are not seeing a lot of severe illness in that age group, it's not recommended that group get vaccinated.
Thank you so much. Yes, so
Yeah.
thank you so much, Dr. Jan. And you did say that those who are not so at risk because of that age group. But what should parents do to continue to keep COVID safe?
Look, I think one of the key things is just communicating with other parents and carers about what's going on with their kids. It's not uncommon for a kid to come home from school not feeling great, but still want to go, and visit so-and-so or do whatever. So try and be as responsible as you can be about encouraging your kids to be honest about how they're feeling and staying home. Give them a bit of a benefit of the doubt about staying home from school if they're actually unwell, rather than sending them to school no matter what. Try and persuade them to wear masks if they can, if they're in crowded situations, or if they know that a few of their friends are unwell. Wearing masks can actually try and help keep them safe as well. And we know that a lot of, young people, as they go back to school for year 12 and so on, they may want to actually, really take up that extra protection that a booster may give if they've got an underlying health condition, or if they're over 18, to talk to their GP or pharmacist about getting that dose.
Thank you so much, Dr. Jan. And as you've seen in the chat, there is some information on the ATAGI advice, and that's shared by our colleague from the Multicultural Health Communication Service. We'd like you to please ask your questions, and Dr. Jan will answer them for you. And we also have Maria Cassaniti, manager of the Transcultural Mental Health Center, as we said, to tell us all about the Transcultural Mental Health Line.
Yes.
The question is, this is fantastic that it's here. Why was it created, and what can we expect?
Okay, so it was created because we know that language and culture influence mental health and how we understand mental health, how we access services, what we do if we feel unwell or we think we have a mental health issue. So language and culture play a big part in everything that we do with health, but particularly in mental health, it plays a big role. So one thing I think that we learned, particularly during COVID, was that we became, that health did different things to engage people from our culturally and linguistically diverse communities, and different ways for them to access the services that were available. So if we take that back to mental health, what we learned in that time was that a mental health line of this type was required. And that's not because other support lines aren't available, but more the point that we understood that our culturally and linguistically diverse communities wanted a line that they felt they could trust, but also talk to people in their own language, but also talk to health professionals that understood their culture. And I think that's the premise of the line. And it's not that our other services aren't working with our culturally and linguistically diverse populations, but it's more that a transcultural mental health line, a specific line for our culturally and linguistically diverse communities, was needed, because we know from the literature, we know that people feel safer when they're speaking to someone who understands them, who understands their cultural way of being, but also who can speak their language.
I guess what Dr. Jan is saying about parents and, school has come up, another advice on vaccination. These are things that sometimes bring anxieties in some parents and some individuals who don't know what to make or what decision to make. And
yeah, and I think that's one of the things that, COVID's left a lot of people now as we're getting back into the world. And also, I think we've got general concerns in the world about, finances, being able to get onto people, all of those sorts of things are really, really important to as sources of potential anxiety. And I think while we have that potential anxiety, people are trying to work out, who can I talk to, you know, how can I work this through? And the Transcultural Mental Health Line is certainly a place to start that conversation. And particularly depending on which culture you come from, you may have a particular role you're expected to play in your family. You may have a particular issue with, you know, I'm not performing well at university or something else. Just to talk to someone who sort of gets you is really important, I think.
Yeah. It's a free and confidential service, so I think it's important to stress that. But the other, going back to the earlier question, we know there are barriers that exist, and one of the barriers around mental health is that there are varying levels of stigma. There's different levels of fear in communities as well, again, because we all understand mental health issues from our cultural perspectives. So we've got to also think that many of our communities that have arrived in the last 10 to 15 years may not have been exposed to some of the mental health campaigns that New South Wales Health has had for a long time and the education that has occurred. So they have different understandings, and with time they will have multiple understandings because they'll have these multi-layered views of what mental health means from their culture of origin and their upbringing, but also how we, I guess, do mental health in Australia. And when I say do mental health, our services and how we want to reach people early. So the importance of the Transcultural Mental Health Line is also inviting people to, you know, ask questions early. No question is a wrong question. Even if you are feeling sad and you want to call the line, that is okay. That's enough to call the line. And there are strategies that we can suggest, but also there's lots of information in language information that's readily available that we can share with callers. So it's important to for callers to understand no question is a wrong question. And also, I mean, what we are covering with the Transcultural Mental Health Line, as we've done with the Transcultural Mental Health Centre over the years, is across the lifespan kind of work with mental health services, because we supplement our mental health services. We don't replace them, we supplement with the transcultural mental health knowledge that we have. So it's really important that if people want to call up about their children and get information, we will then link them up to the appropriate child and family services if that is what's required. It might be firstly just a question that we can answer easily, then we'll do that, and we'll invite people to call us back if that's what they want to do down the track. We've had calls already about our older persons, so sometimes children ring in about older parents or parents that are having mental health concerns. Sometimes it's about their siblings, sometimes it's about their friends. So it's important. We are encouraging individuals to call directly. So it's not about service providers calling for their client. It's about individuals calling us. But we also know we have to be flexible, because we know that some individuals need that first support to call, and it's okay for a service provider to be with the person to call. It's okay for another family member to be with the person to call again, but it's about making sure that's what the person wants at that point in time.
Yeah, and I think I wanted to ask Dr. Jan, what are the signs? I mean, we see we've talked about this many times, when you need to just reach out to someone that you haven't heard from, or give a call, or if you think you're feeling something might be wrong and the person that is acting not as normal as usual, it's okay to reach out to them, isn't it? And maybe suggest a line.
Absolutely, because I think a lot of people are still looking for resources that can help them. Some people are still finding their way back to social interaction because they may have found it easier to sort of withdraw, and trying to get back and talk to people can actually be quite a challenge for some people. So being able to talk that issue through is helpful. I think the other thing is, if we see changes in behaviour where, somebody's getting irrationally angry, or somebody's just bursting into tears, we see people changing their eating habits, difference in risk-taking behaviours. All of those things can be a sign that something else is going on with that particular person. And you can either encourage the person to call the Health Line. You can get them to talk to their GP if they've got a trusted GP. But the importance is making sure that they know that there is help available. They may not recognise that they need help. And so that's where you being a gentle friend or a gentle, kind person can make a huge difference. Just to even say, look, there might be nothing wrong with you, but these people might just be able to help you sort through this thing anyway.
Yeah.
Or give you additional advice. It's about giving the person additional advice. It's always great to have friends. But what we're trying to do with the Transcultural Mental Health Line, as we promote it in communities, is really have everyone own it. And it's good that the more people know about it, the more they can tell others about it. And I think that's a really important step forward as well.
And it's available for multicultural communities. And I guess that's a question that's would come up. It's the languages and also the culture. Yeah.
Yeah, we've had questions around which languages are available, and we have to move away from that thinking. We are a service for all our CULD communities, for our culturally and linguistically diverse communities. And it's really important while we have, so how the service works, we have a small team that covers the line, but it's backed up. And of course, this team are health professionals, psychologists and social workers, but trained in mental health, but they are backed up by a well-established pool of clinicians, social workers, psychologists, clinical psychologists, mental health nurses, and so forth, who are qualified, are registered, and speak other languages other than English. So that's really important to know. And so, and between them, they speak over 30 community languages. And so what will happen, and I think another question, and it's important for communities to know this, and the media. So what happens if someone calls up and we don't have that language on staff? That's not a problem, because our clinicians are trained to work cross-culturally. They are trained in transcultural mental health practice. So if we don't have the language at that point in time, or that staff member is away, then what we will do is we will work with an interpreter. So everybody can use this service. And in time, as Transcultural has always done, we always recruit new sessional clinicians, and we are working hard, and we will be working hard in the next few months to get some new clinicians on board, because we're trying to really reach out to new and emerging communities as well. So if anyone knows anyone out there, or if you want to encourage new professionals or people to go into this wonderful field, and particularly use other language skills, it's really important. And for those mental health professionals that have been in the system a long time and they do speak other languages, please call us, because we need you at this point in time.
Thank you so much, Maria. And then I guess I particularly like the fact that there's no question that's stupid. There's no question that's wrong. You can, if you're feeling like you need someone to talk to, you can call this.
Exactly right. And it's just that feeling, when your well-being is out of balance, because again, I have to stress that how I think about mental health and how you might think about mental health may not be the same. It might be about well-being. It might be different words that you use to express how you feel. So, any question, if you're feeling sad, if you're feeling down, if you're feeling not right, it's okay to call. Yeah.
Dr. Jan, there's so many other issues in health that we're hearing. There's a public health matters. We had COVID, and also there's the monkeypox and also Japanese encephalitis. Were there any updates that we had for those health matters?
Yeah, so one of the really exciting events that's coming to New South Wales soon is Sydney World Pride. And that's going to be a huge festival from the 17th of February to the 5th of March, with events all over Sydney, and a really exciting program of events. What we are encouraging people to do is to make sure that they're up to date with their Mpox vaccination, and that's the Jynneos vaccine. 2 doses are needed to help give you protection against Mpox. And so it's really important that if you're participating in events, and particularly if you're going to be in very close contact with other people, that you get your Mpox vaccination. It's really important. You can check your eligibility. So see if you are going to be one of those people that we're talking about who are going to be very close to other people, your symptoms, and look for clinic locations, because they are across New South Wales, and make a booking online to get that vaccination done. If you are having any symptoms of mpox, which can include some skin rashes, particularly around the genital area, and you're not feeling great, please don't go to any more events. Don't contact with other people because it can transfer with close contact between skin to skin. Don't go to World Pride events, and talk to your GP. If you're having trouble finding a GP, or if you're from interstate, calling the New South Wales Sexual Health Info link on 1800 451 624 can help give you advice as to what to do next and how we can help you. There's publicly funded sexual health clinics. They're not going to ask you for a Medicare card. They are completely free. So if you're a guest and attending World Pride, please keep safe and enjoy it. I think it's also really important that, generally speaking, we're just going to go through the same things that we're saying for any mass gathering at the moment, which is, if you're unwell, don't go out. Please keep your germs at home. Stay up to date with your vaccinations. Think about wearing that mask in crowded indoor settings, and get together outdoors wherever you can. I think it's going to be a really exciting festival. There's been a huge amount of planning into trying to help keep people safe and well. And so anything that people who are participating can do to stay safe and well would be fantastic.
Yes, and we've got all of those information online, and please ask your questions. We've got a few more minutes left, so please ask the questions that you have for Maria and Dr. Jen.
Jess, I think you also asked me about Japanese encephalitis.
Yes.
So we've had Japanese encephalitis in New South Wales, and also another disease called Murray Valley encephalitis that can make people sick. It happens when you get bitten by mosquitoes. So we're really, really encouraging people who are spending time outdoors to do what they can to avoid mosquito bites. They're particularly bitey around dawn and dusk. Best way is to not give them so much access to your skin. So wearing light coloured long sleeve shirts and long sleeve pants will also give you some sun protection as well if you get the right stuff to wear. But please do be really careful if you're out on the inland lakes fishing, if you're camping, if you're working. Please do think about getting that Japanese encephalitis vaccine. It's available through GPs, pharmacies, and through particular clinics. You can read more about that on the New South Wales Health website.
Thank you, Dr. Jen. And yeah, it's really important to be aware of and get that information, that update information, New South Wales Health website and also the New South Wales Government website. Now, Dr. Jan did mention that we have a lot of guests coming in for the wonderful event of Pride, Sydney World Pride. Attendees are coming to Sydney. Can they call the line?
Absolutely. They can call the line. I think we're probably an option for them, especially if they speak other languages. So they certainly can call the line. We are New South Wales only, though, so they'd have to indicate that they are, obviously in New South Wales for a short period of time, and we would provide them with information that they require. Yeah.
I think that's really good information. That's important, because a lot of the visitors are wondering, we can't use other services. That's not for us because we're visitors. Yeah, and we can give them some short-term strategies, so that is fine. Another important thing to mention in terms of who can call the line, it's also important to stress that it is for carers and family members as well. So not just an individual who's experiencing feeling unwell, but also carers and families that may need support themselves or information. So it's important to stress that as well. Dr. Jan, how important is this line for GPs and other health clinicians to advise for their patients?
I think it can be really empowering for health professionals to know this type of resource exists, because sometimes you might think, well, that person doesn't really need a huge intervention at the moment, but having a conversation with people who actually understand their background and culture might be of help. And also getting referrals, of course, from the line where it's appropriate, where the GP may be able to actually say, there's some other things that we can do, and here's a referral for, additional services from psychology, or whether somebody might need medication or people may need additional help. So I think it's that thing that there's no wrong way in, I think is what we're trying to make sure is happening.
Exactly right. And the other benefit of the new line is that we have re-engaged with a lot of service providers that don't necessarily work in mental health, because of course Transcultural Mental Health has always had its clinical consultation service, and that service has always worked with our public mental health services community and hospital. But because of the new line, service providers are ringing and inquiring about it. And it's an opportunity, because we've always been able to provide service providers outside of mental health with cultural consultation, if that's what they need. And sometimes just having that little bit more information about a particular culture helps them then work with that individual or that family. So that's the other benefit of the Transcultural Mental Health Line, even though that's not for the service provider, it's for the client, for their client or the person calling. But the benefit is that they're contacting Transcultural Mental Health. And with that, we can also provide the service providers with more information as well.
And I've noticed that the line has a specific time frame. Why is that? It's not a 24-hour service.
Okay, so the service has been set up as a 9 to 4:30 service, Monday to Friday. It is because it was set up to enhance access for CALD communities. It's not a crisis line. It's certainly not a post-discharge option. And we have a lot of services, and I believe that the services like Lifeline and so forth, and our New South Wales Mental Health Line as well, that is available 7 days a week, is on the chat. Okay, so please do look at those numbers. So it's really important to stress we are not replacing those services for CALD communities. CALD communities should and can access, and always have been able to access those services. We are there, though, to supplement those services. So, you know, for example, if they ring up the New South Wales Mental Health Line over the weekend and the Mental Health Line deems that this person might benefit from them calling us on a Monday, Tuesday, Wednesday, whenever, that's what they can do. And they can then usher them in back to us if they feel that's safe to do and that it's appropriate for that individual.
Yes. Great information. Maria, what is it that you'd like the multicultural media that's online today to be able to emphasize and give their audiences?
Okay, so the important thing is that we have got the information about the line. We've got postcards available on our website. And that will be put on the chat as well. So that the postcards have been translated into 42 languages, which is really important. And in time, we will do even more languages. And there's also social media tiles as well that obviously are there to be used and to be used by our media. Where the media can help, they will play a big role, because they can, you know, their information can reach communities at the grassroots. And I think that's really important. So they can help with sharing that information via the various ways they do that: social media, by television, by radio, and so forth. So it's really important that the media, you know, contacts New South Wales Health, and if it requires some of this information to be done in language, we can also offer and organise with New South Wales Health our Transcultural Mental Health bilingual clinicians to also speak to their own communities as well, and to be interviewed by the media. So that's a really good way to move forward. So the multicultural media has a big role to play. Transcultural does work also very much with destigmatizing mental health in communities, increasing mental health literacy with our multicultural community agencies. So again, the media might want to attend that. They might want to be part of that. So there's different creative ways that we would like the media to be involved.
Thank you so much, Maria. And we're almost running out of time, but Dr. Jan, it's just great to hear services like this. You know, we've waited to have this line through COVID, and it's here. And especially with what's happening around the world, this is just very important.
Look, I think understanding somebody's culture and understanding the expectations of how you were raised and how you are meant to act, it's a huge difference. I mean, I've only been to England to live, and even the differences between Australia and England and some attitudes and how things work, it can be really stressful when, you know, people don't quite understand that an Australian says, you know, one thing and they actually mean something completely different to an English person, and that's speaking the same language with the same general cultural background. So when we're talking about people from all sorts of different places, those expectations that you've grown up with, that familiarity is so very different, I think. And so having people who actually get that without you having to explain all of that over and over again makes a huge difference, I think, and would be a sense of relief, I'm sure, for many of your clients.
Absolutely. And it's about that trust and a trust in service. And we know that once we do that initial engagement, we are a bridge to other services that they may need. The beauty is that we also will look at the individual's situation. So they'll be connected to a relevant service for them. And sometimes it might be just a social support service in their own community. It can be a multicultural agency that they don't know about. It doesn't necessarily have to be a mental health service. Look, the other important thing I think about the Transcultural Mental Health Line that we should touch on today is that now that we have the line, it can do things like, for example, the events that have just unfolded in the last few days with the earthquakes in Turkey and in Syria. It means that people can quickly call a line that they feel, safe and comfortable in using. And I believe years down the track from now, it'll be just what people do. At the moment, it's about getting the information out there. But so a service like this can be, it is a resource, a really good resource that New South Wales has put out there because it's readily available. We don't have to set up lines quickly. It's going to be there. And, in the future, if demand increases and we might need to open it up for longer hours, that may happen. At the moment, that's not the case, but that's something that is going to be, it's bigger than my decision. It's a whole of New South Wales health decision, but it's going to be flexible enough to eventually do that. And I wouldn't suggest that right at the moment, but eventually it can do that. And we know we're going to have these events. We know that people, and I think it's like Jan was saying, people are financially stressed at the moment. We know that's hitting us at the moment, and many families are impacted. And of course, many of our cold communities are going to be impacted. So it can be that the stress factors are financial.
Yes,
yeah.
And also for young people, parents.
Yeah, and I think the fact that it's private means that for some young people, and let's face it, a lot of young people aren't allowed to, well, not so much aren't allowed, just financially cannot leave home. And so there's often a lot of intergenerational living, and, even that sort of conflict is a stress. And so being able to talk to someone who gets those family dynamics is huge.
And more thing I'm thinking about is we don't speak enough about migration and settlement. We are very good at speaking about it in a positive way. And I think it's very positive. Australia has a very positive, I think, overall migration experience. However, even in the best of circumstances, migration is difficult. And so I think being able to call a line, not just about culture, not just about your language, but the fact that you are talking to health professionals that also have a recent migration experience.
Yes,
exactly. So they speak your language, they have affiliation with your culture, they might directly be from your same culture of origin, but importantly, they also can speak about migration. We don't speak about the impacts of migration enough as something that impacts on health. And I think we normalize. And so what the line will do will be normalizing it and saying to people
that it's okay to talk about it.
And it's okay to be stressed about the migration, your migration experience, even if it's a very successful one. So that, and the people on the end of the phone will understand your story. Migration can be easier for some families, and we know some families, particularly people with refugee experiences, people that their visa status is still not firmed up and so forth, have different experiences. So I think it's about knowing that your story will be understood in its own way, because we're all different.
That's correct. Yes. So we've run out of time. We can talk forever about this line, and it's just wonderful to have this line. I, for one, understand, having migrated here myself, and that experience. And if there was that line before, I could have called when I was being stressed. And exactly what you're saying, Jan, having lived in 2 countries, it's just difficult. It's not. It may not be. It may be positive. It may be just challenging or just different. Actually, different.
And a long way away as well. When when things are happening, you're a long way from often a long way from supports.
Well, one of the barriers for many people in seeking support is just they don't have anybody around them, and that's important as well. But I just think understanding people's migration stories at the heart of what we will do as well. So.
Well, that's a great way to end this session. Thank you so much, Dr. Jan. Any last words?
Just, I'm hoping everyone's taking advantage of some of the nicer weather we're having and getting together with friends and family outdoors. It's really nice to have some sunshine for a few days in a row.
Thank you, Dr. Jan. And Maria, thank you so much for joining us and for telling us all about the
Thank
mental health.
you. I think just get the word out there, and that, yes, you will all be ambassadors for this service as well. So we will be grateful for that. Thank you.
Thanks so much. And that's it for today, our very first session for 2023. We will be back in the next fortnight for the Multicultural Media Online Forum. Please email us if there are any questions that you may have on the topic that we discussed today, or if you need any services or support, let us know, and we will try to pass this on to the relevant people. But if you also have topics that you'd like us to feature, let us know. The recording of this session will be available on the Multicultural Health Communication Service website, and we'll also send out some of the resources, including the social media tiles that Maria has talked about, as well as some of the links that Jan had mentioned. Thank you so much for joining us. We'll see you again next time. Stay safe.